Medical Notepad, brought to you by Cardiovascular Systems Incorporated's Patient Advocacy Campaign, Take a Stand Against Amputation, and The Way to My Heart.
Hi, this is Agustisa, vascular surgeon from Spain. So I think today we can talk about revascularization intrapopliteal, when it's indicated, or what to do, and what sort of patients are best target for every specific treatment. And I think the first thing that you need to keep in mind that medical treatment is usually the best option. And when I think about medical treatment, I'm talking about anticoagulation like aspirin or clopidogrel, and also trying to keep your lipids lower. So talking about statins or whatever. So also the most important thing is just to keep on walking. Walking is the best medical treatment you can get, because by walking you will increase your collaterals and this will maintain your foot alive. Because the main issue is like when you need to treat a blockage, and the answer is a blockage is not the indication. You can have 100% blockage below the knee, but you may probably be free of symptoms. And I'm not talking about pain on your calf, pain on your claudication, you know that. Is not an indication for any infrapopliteal revascularization. For these sort of patients, the treatment is to keep on walking and to control your risk factors. Because we know that if you are a claudicat, you are not in risk of losing your leg. So when are you true risk of losing your leg? When you have pain on rest pain, or when you develop ulcers, toe ulcers or heel ulcers. So that's exactly the point where you will need a revascularization. And again, it has nothing to do with the degree of or the percentage of blockage you have on your arteries. So if you rise to the state of when you have breast pain or you have ulcers on the toes, on the knee, definitely we need to choose what is the best treatment for you, the best surgical treatment. And you can either choose endovascular or a bypass, and it will all depends on three important aspects. First one, what is your physical condition? If you are fit enough for a bypass, this is a good and durable option. The second one is if you have a good conduit, if you have a great vein. I'm sure you all have heard about all of these BCLL trial, which has proven that if you have a good vein, this is a good durable option. But sometimes this is not the case, and you probably don't have a good vein or you are not fit enough. And for this, you need an endovascular treatment. But keep in mind that to get a good endovascular treatment, you need to have a good physician to perform your treatment. And this is not usually, or it's not always the case. I'm really concerned about all of these patients that ended up in a major amputation without even having a DSA to know if they have a vessel to be treated. So first step to keep in mind, just keep on walking. Second thing, once you get to this stage of having breast pain or any ulcer, just look for a physician that is going to look after you. Look for the good physician and never ever accept an amputation before having an angio. And if you don't get an angio from your physician, look for a second opinion. I think probably this would be, generally speaking, a good approach for these sort of issues.
Remember, the advice and views offered during this series are for informational and educational purposes only. Always ask your own healthcare provider for explicit consent before acting on any information provided here. If you want more information on peripheral artery disease, go to standagainsamputation.com. And for real-time support, go to thewaytomyheart.org.